Imagine a drug so powerful it can stop one of the biggest killers of new mothers dead in its tracks. Now, imagine that same exact drug, if you use it wrong, could become the killer itself. Okay, let's dive into the fascinating story of Methylergonovine, a true double-edged sword in modern medicine.
So, to really get why this drug is such a big deal, we have to start with a really important question. What is one of the most dangerous and feared complications of childbirth all across the globe? And the answer is postpartum hemorrhage. You'll see it called PPH. This is just severe, uncontrolled bleeding after the baby arrives, and it is a terrifying medical emergency where literally every single second counts. All right, so let's start by digging into this hidden danger of childbirth. We need to understand the specific biological problem that makes a drug like Methylergonovine not just helpful, but absolutely essential. So what's actually happening here? Well, the number one cause of this kind of catastrophic bleeding is something called uterine atony. And it sounds complicated, but it's pretty simple. The uterus, which is just this giant, powerful muscle, fails to clamp down forcefully after the baby is born. And that leaves all the blood vessels where the placenta used to be just wide open. Okay, so if the problem is a muscle that just won't squeeze shut, the solution has to be something that can force it to. So let's jump into section 2 and see how this drug acts like a powerful artificial uterine clamp. Methylergonovine is part of a family of drugs called uterotonic agents, and their one job, their whole purpose, is to get that uterine muscle, it's called the myometrium, to contract, and to contract really, really hard. And where does it come from? Well, it's a super potent, semi-synthetic compound that's actually derived from ergot, which is a type of fungus. It's literally engineered to create a muscle contraction that is both incredibly fast and lasts for a really long time. So how does it actually do that? The mechanism is kind of like a two-punch combo. First, the drug latches on directly to specific receptors on the uterine wall, serotonin and alpha-adrenergic ones. And then step 2, that binding is like flipping a switch, triggering this massive, powerful, and what doctors call a tetanic, meaning prolonged, contraction of the entire muscle. And all of this leads to its nickname, which is just perfect, the physiologic clamp. That powerful, drug-induced contraction physically squeezes the uterus shut. It literally compresses those open blood vessels and stops the bleeding. It's a brilliant mechanical fix for a mechanical failure. But a tool this powerful comes with a very specific set of rules. So let's move on to our next section and look at exactly when and how this drug is actually used by doctors and nurses. And you'll notice its uses are super specific, super narrow. It's used to treat a hemorrhage that's already happening. But it's also used, and this is very common, to prevent one from even starting. It's the go-to for uterine atony and can also be used for bleeding in other situations, like an incomplete abortion. Now, how it's given is a huge deal. The most common way is an injection into the muscle, an IM shot, which gets to work in just a couple of minutes. But in a real life or death emergency, it can be given through an IV for an almost instant effect. But, and this is a huge but, that IV route is risky. It can cause a stroke and it has to be given very, very slowly. The oral pills, they're much slower, really only for follow-up care. And this brings us to what is probably the single most important rule of them all. You can never, ever, under any circumstances, give this drug before the baby is born. Why? Well, can you imagine what those intense, full uterus contractions would do to a baby still inside? It would be absolutely catastrophic. And that warning, well, it's the perfect doorway into the other side of this drug's personality. So now we're going to pivot to its darker side, a catalog of really significant risks that mean doctors have to be extremely careful. Here it is, the core problem. The very thing that makes this drug work is also what makes it so dangerous. While it's clamping down on the uterus, it's also causing vasoconstriction, which means it's squeezing and narrowing all the blood vessels throughout the entire body. And that body-wide blood vessel squeezing leads directly to the side effects. Sure, nausea and headache are pretty common, but the big one, the one everyone really worries about, is by far hypertension, a sudden, severe spike in blood pressure. And we're not just talking about your blood pressure going up a little bit, no way. This can trigger a full-blown hypertensive crisis that can directly lead to a stroke, to seizures, or even death. This is exactly why a patient's blood pressure has to be watched like a hawk after every single dose. So, because that risk is so real, there's a list of absolute no-goes, times when this drug is just off the table. If a patient already has high blood pressure or preeclampsia or any kind of heart disease, it is way too dangerous. Same goes for severe kidney or liver problems, or if the patient has a serious infection. And if you thought that was it, the danger actually gets even more complicated. If you mix this drug with other medications that also narrow blood vessels, the effect can be catastrophic. Even some very common antibiotics and antifungals can mess with how the body processes it, leading to toxic levels. Okay, so we've seen its incredible power and we've seen its serious dangers. Let's bring it all together in our final section and really understand why it's known as a life-saving, double-edged sword. Even with all those scary risks we just talked about, the experts are really clear on this one. They consider Methylergonovine to be indispensable in modern obstetrics. The simple truth is, the lives it saves far outweigh the risks, as long as it's used correctly. This really sums it all up perfectly, doesn't it? The drug's whole identity is a 50-50 split. Half of what it is life-saving power, and the other half is significant, always there risk. You just can't have one without the other. So, what's the bottom line here? Methylergonovine is this incredibly powerful tool that stops women from bleeding to death. It's a hero drug. But it's a hero that demands our profound respect for its dangerous side, and it requires constant, vigilant monitoring. And all this leaves us with a huge question, one that sits at the very heart of medicine itself. In those critical moments when a life is on the line, how do we continue to weigh a tool's incredible benefit against its equally incredible risk?